First of all, dear colleagues, I want to thank All India Ophthalmology Society, Mr. President, Dr. Mahipal Sajdev, immediate past President, Dr. Natarajan, Honorary Secretary, Namrata Sharma, and Honorary Treasurer, Rajesh Singh, for organizing this seminar. We really appreciate the friendship that we try to keep over these years, and to have this legacy of Professor Fyodorov, and to keep it as tight as possible. Without talking too much, I just want to briefly remind you about Fyodorov. If you Google his name, you will find that he's a very prominent Russian ophthalmologist who developed radial keratotomy. He actually was born in 1927, exactly 93 years ago. He wanted to be a pilot, but because of the accident, he lost his one of his legs, and that's why he went into the medical college, where he worked hard on different while studying and working on different projects. But finally, we were lucky to having him as an ophthalmologist. And one of his inventions, which is a Sputnik lens, the actually iris clip lens that was quite popular at that particular moment, and the first implantation was actually more than 60 years ago. That's why he became one of the founders of the intraocular lens community that accepted him as one of the pioneers of that kind of surgery. And of course, radial keratotomy, when the radial cuts are performed from periphery to the center of the cornea. And there was a lot of innovations at that time. First computer programs that were calculating the results of and the prognosis of the radial keratotomy, diamond knives, a lot of microsurgical instrumentation. So it was using ultrasound to measure the cornea thickness and so forth and so forth. So it was kind of, breakthrough and innovation. And we see that the number of radial keratotomies peaked in 1990s with over 1.2 million, and then for obvious reasons declined over the years because of the laser surgery that arrived. One of his achievements was to build the Eye Microsurgery Institute that was built from the scratch in the northern suburb of Moscow. And this is how it looks like, pictured from the drone. This is a big institution with some educational facility, outpatient facilities, and manufacturing facilities. And there were a lot of other innovations, such as buses, microsurgical ships, and even railway bus that was traveling throughout Russia, and the conveyor belt system that was built both for diagnostics and also for surgery in a linear and a circular fashion that's shown here. However, one of his major inventions was to building the Eye Microsurgery Complex, which is the main headquarters having in Moscow, and 10 branches all over Russia, as shown here, and each branch is having around 8 some other smaller clinics. So overall, we now have more than 5,000 employees and doing about 300 surgeries a year. So Fyodorov was a hunter. He liked horses. He liked people. He liked to interact very much and to meet the new people. He liked helicopters, and he died actually in the helicopter crash in 2000, in June of 2000. So we, of course, remember him as a great ophthalmologist, and he tried to keep his legacy. And I thank you very much for your kind attention.